All right. So what I am going to do, come to me, guys, come to me. So what I'm going to do is I will just as per usual, this class, nothing is different. I will be uploading the videos just like I did last term. I have not yet decided, I think, at least for through the skeletal, I'll upload them on the same playlist. You don't have to access anything different. All right, so, yes.
No, one question I do have, I guess about one internal bone of the face is the pterygoid bone. I covered it or not. So is that part of the
So here, I'll just go back to this. There's our sphenoid. Bones of the ear, everyone okay?
I don't think you went over that, because my highlighted stuff, slide 58.
Okay. All right, so I'll just back up a little bit.
Thank you, Mr.
All right, so the bones of the ear. Remember, sound is an illusion. There is no such thing as sound as we think of it. What sound is the interpretation your brain is making of the vibrations that are exiting my vocal cords as they slap together. You have three little bones, creepy rule of three. You have three little bones in both of your inner ears. And what happens is those vibrations cause the bones to rattle against each other. Click, 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 click. That then converts into an electrical impulse at the cochlea. You've all heard the term cochlear implant. That's what that does. It converts the vibration into an electrical impulse, and that electrical impulse is then sent to your brain and interpreted as sound. So if you don't have these bones working, guess what? You're deaf. There are two reasons why you would be deaf. Either because these bones are not working or are malformed in some way, or your cochlea is not working to transport or convert the vibration into an electrical impulse. If it's a problem with the cochlea, now this is for humans only, okay? We don't do this on animals. But if it's a problem with the cochlea, we can put in a cochlear implant to artificially convert the vibration into an electrical impulse. If it's a problem with the bones, there's nothing you can do, which is why it's so important that you don't blast super loud music into your ear. Because if you get those bones really slapping together, you can in fact cause damage to them, decreasing the sensitivity to pick up vibrations, which is going to give you hearing impairment. And the eardrum, so the eardrum, which is also known as the tympanic membrane, what it does is it helps to amplify. Just like a bass drum, it amplifies the vibrations. The three bones in the ear are the malleus, that's how we say that, the malleus, the incus, and then the stapes. This is not stapes, we say this is a stapes. And so those are the three that their job is to pick up the vibrations. The cochlea then transmits them into an electrical impulse, and the brain then interprets.
So whenever like you're starting to wear the ear, like ringing in her ear, is that something that we made up as us saying that we hear the ringing, or is that actually something happening with the
Okay, so you're talking like tinnitus?
Yeah.
So what tinnitus is damage to the nerve or the cochlea.
Okay.
Because your bones are not going to pick up anything if there's no vibrations. Right? So when it's just absolutely silent, you're not picking up any well, you might be picking up the fan, but you get what I'm talking about. This is damage to the actual nerve. where the nerve is now sending an impulse where there is none. And your brain is perceiving that usually as a very, very high pitched sound constantly.
So,
And depending on the damage to the nerve, that will determine how loud are you perceiving the sound. So sometimes you can have tinnitus where it's infrequent, just every now and then. I have tinnitus.
Yeah.
But not all the time. Every now and then I just hear this random high pitched noise. Yeah.
mine's all the time.
And then if you have very, very frequent, that's just the degree of the nerve damage.
What about that like whoosh you get and then you hear the like, I don't know like if you get it, but like it'll be like a whooshing sound and then like it's super high pitched for a second. Like I think I'm deaf and I feel like snap and then like, but I'm not
That
deaf.
I don't know. That I don't know. You stumped me. I don't know.
Yeah,
Yeah, I get this.
since
So-
we're not crazy.
It's- Could be wax moving. Yeah, like
Oh, hang on,
I mean,
guys.
like an ear popping, because sometimes my ear will pop and then
Yeah, I mean, there's atmospheric changes. So when you're on an airplane and you get the plugging of your ears, what that is, so not in action, but think of the bubble in a level. Okay, the bubble in a level, does everyone know what I'm talking about, the bubble in a level?
No.
Yeah. So when you level something up. it's-
When you level, there's a bubble. No, like the level, and if you move it like this, the bubble moves, and then when you get it between the lines, it's perfectly level. Well, think of that inside your ear. So you have the bubble, and every now and then the pressure in the bubble or outside of the bubble will change. And that's why you can get the plugging of your ears. The pressure has changed different from the inside to the outside. And then you have to, then what do? You plug your nose and you blow. Carefully, don't blow out your eardrums. But what you're doing is you're equalizing and normalizing the pressure on the inside behind the tympanic membrane. And that's why you hear that pop. Because you are, and that's why you gotta be really careful that you could blow out your eardrums. Because the pressure on the other side of your eardrums is what's being equalized.
Do pets like experience it as bad as we do? Or are they just better at like fixing their ears?
I don't have an answer for that because I've never, I mean, I can't ask them. So there's the picture of our 3 bones and the cochlea.
Your cochlear implants don't always work.
They do not, and they do not cause you to hear normally.
It sounds like robotic almost. Like my friend, his family decided that they wanted to get him a cochlear implant instead of like them learning sign language. And
Yeah, most people that get one end up removing it because
Yeah.
it's better for them mentally just to not hear than to hear with the cochlea.
he was on like a lower channel, and so like it just sounded like robotic buzzing. Like he couldn't even hear anything, so they just wasted like $60,000 on that.
Yeah. All right, so so those were all the internal bones. They're very, very expensive. The external bones of the face, the incisive bones, which are your teeth bone. Well, not all of your teeth bones though, because we also have our incisive and our maxillary and our mandibular, right? The cheek teeth. The upper is the maxillary cheek teeth. The lower is the mandibular cheek teeth. And it is the front that is the incisive.
So it's just your top teeth are your incisors, horizontal.
The top is the incisive, and then the bottom is primarily mandibular. Now our ruminants, now I do know we did talk about this last week. Ruminants have that dental pad on the top. Because I talked to you about how even though they don't have any teeth on the top, they can still bite you. And cow bites are crazy, crazy. Worst bite. One of the worst dog bites I ever had in my career was from a dog that had no teeth.
It's a hard bone.
Because they develop a dental pad on upper and lower. And so I had actually done a full mouth extraction on this dog. Yeah. And it was this little poodle, and boy, he was mean. Oh my God, he was mean. And I didn't do it for fun. He had a massive periodontal infection, and I'm just plucking dead teeth out like they're rotted fruit. Pulled them all out. This dog did not have a single tooth in his head. And he came back 10 days, 2 weeks later for a recheck, and I'm like, what are you gonna do? Bite me? And he bit me. But what happened was normally it will puncture, they release, they retreat, they assess. This, he grabbed it, and because there was no puncture, his whole dental pad grabbed and separated the muscle.
Oh,
So I ended up, oh my God, I'm serious, you guys, worst bite I've ever had. So he bit me like right here, and it separated the muscle and gave me a hematoma. Oh, we can't stop using our med term, you guys. A blood blister this big. And I physically could not use my arm for close to 3 weeks.
You've been through so much.
So it did not leave a scar because it didn't penetrate the skin. If it breaks the skin, then yes, it's going to leave a scar. But this, all he did was he grabbed it and pulled, and it pulled it all away and separated that muscle group. Oof. Nasal bone obviously forms your nose, and the size of the nasal bone will depend on not only the species, but also the breed. Right, like a horse, an equine, is going to have a much, much longer nasal bone than a human. And then, of course, our canines, you have your dolichocephalic, brachiocephalic, and then normocephalic.
Does it get a cool name too?
Do they what?
It's just normocephalic.
Normocephalic is literally somewhere in between dolicho and brachio.
What are the inches for it?
There's not a specific inch. If you want to think about a normocephalic, you're looking at like a beagle. Like a greyhound is a dolicho. Obviously, a pug is a brachio. Anything in between the two. Pointer, your terriers.
So it's not like an actual number because you can have a big, like, dolichocephalic and a small one.
Right.
Okay.
The maxillary bones make up the upper jaw cheek teeth from your canine's back. And then you have your lacrimal, which I know, again, we talked about last week because we talked about, it reminds me of lacriminal. And that's how I remember tear duct, because what do criminals do when they get caught? They cry. So the lacrimal duct is your tear duct.
Someone made a joke, it was a French criminal, something like that. Someone made a joke about that. It was on, I read it in the message box before we went on break, and they're like, oh, I think it was, I went somewhere, sorry.
That's okay.
I don't know where my brain went with like the teardrops.
It was Nathan.
Oh, yeah.
Yeah.
It's a French criminal. That's what they
A
said.
French criminal.
Yeah.
So our zygomatic, you've already told me, it's your cheekbone. Mandible is the lower jaw. And then you have what's called the symphysis, which is a slightly movable joint. Tell me the medical term for a slightly movable joint. Amphiarthrosis. Very nice. Amphiarthrosis. I got another one down here. Amphiarthrosis. Picture. And right here is that symphysis.
And is that like a suture?
It doesn't look
Is
like
not. So a suture is an immovable joint. So immovable, the suture is a fibrous immovable joint. This is a cartilaginous, slightly movable joint. Synovial is freely movable, which would be your diarthrosis. Synarthrosis, fibrous, not movable at all. Amphiarthrosis is cartilage, slightly movable. Diarthrosis, freely movable. Synovial joint.
Is it movable in case there's like a break?
So the reason why you have the symphysis here is so you don't break your jaw if you're chewing something hard. Because if your mandible was one solid bone, if you bit down on something, the way that your jaw, it would break. The tension points would break. You need to have that little bit of give in order for you to bite down on something very hard and not break your jaw.
Okay.
Your pelvic symphysis helps as a shock absorber, but is also going to allow the pelvis to split when you are giving birth. Your pelvis breaks when you give birth. So that's how when you have somebody who in the forensic files who's like, hey, yeah, this skeleton pelvis is a male or a female. What they're looking at, males also have a symphysis, but it's not as well defined because it doesn't have to break.
I know like the snake jaw isn't like the front part is gonna be back here. Do they just have more like cartilage and like?
So what they have is an ability to unhinge and dislocate their jaw.
So it's not the same as like.
It is not the same. It's just how their lower jaw hinges into their upper jaw. They're able to unhinge it and open their mouth to the extent of the soft tissue. Whereas we can only open our mouths as wide as our joint will allow. But if I could go, suddenly now I could open my mouth this wide if I wanted to. Here's a radiograph showing that symphysis. Very defined symphysis. There's our palatine, pterygoid, vomer, and turbinates. Palatine makes up the palate. That one's kind of a no-duh. The pterygoid helps to support the pharynx. Your pharynx is the shared room for activities. I don't know if we talked about that. So when you are looking at the anatomy, here I've got this person's mouth and nose and eyeball. I have the oral cavity and I have the nasal cavity. The oral cavity, well, first, the nasal cavity comes down to the windpipe or trachea. The oral cavity passes over that and becomes the esophagus. But right here, so here's the opening and here's an opening. Where we have these two openings, that's known as the pharynx. So I have I have a movie that is my guilty pleasure, and that would be Step Brothers, the Will Ferrell movie. Has anyone not seen the Will Ferrell movie Step Brothers? A few of you, so this is not going to help. Those of you that have, there is a scene where the two stepbrothers are sharing a room, and they've decided to build bunk beds. And they have so much room for activities. It's blowing my mind how many activities we can do. That's the pharynx. If you think of each of the stepbrothers as one of the openings, one's a trachea, one's an esophagus, the room is the shared room for the activities. That's the whole point of the pharynx. So it's blowing my mind. It's blowing my mind how many activities we can do in here.
This is a bad idea. Why do you
Do you like guacamole? I have that movie like memorized. I've seen it so many times. So that's the pterygoid. The vomer. In between your nostrils, you have what's called a septum. A septum is just a fancy medical term for a wall, right? You had your also walls in your heart. You guys just finished the heart.
Yep.
You had your intraatrial septum, your intraventricular septum, septum meaning a wall. So are you okay? Oh my gosh.
No, I'm fine.
You're good?
Yeah, no.
Okay.
Give it 4 times.
Yeah, the desk is like, yeah,
Oh dear.
yeah.
You have a separation in between your right and left nostrils. Right? That's why when you ram your finger up your nose, don't try this. But if you're getting right, like you're just digging away up there, you can't curl it over and bring it out the other side unless you've done something to damage that septum. There are, how do you say this delicately?
Yep.
Little Columbia white that'll eat through your septum. And that's when you can put stuff up and then bring it out the other side. Yeah, you're not supposed to be able to do that. The medical tech, so septum is just a catch-all for a division, a wall. This particular wall is called the vomer, which means it's the one we're finding in our nose. And then finally turbinates. How much more can we say about terminates?
Question, so whenever you break your nose, that's what you're breaking the septum, correct?
Yeah, so you're breaking the septum. You could also be breaking the cartilage because we do have a small nasal bone right here at the top. And then all of this is cartilage. When you say you have a deviated septum, it means that that vomer bone is it has moved one side or the other. It usually is following some sort of trauma where you've broken your nose and it didn't heal properly. And the problem is if you have a deviated septum, it means that the air is not going into your nose equally, which would cause you to do snoring, apnea, etc.
So when people get like a nose job, is that like this, like they?
Yeah, so one of the things they would have to do, because, everybody's like, I got a nose job because I had a deviated septum. No, you didn't, but that's fine if you want to say that. But what they're going to do with the deviated septum is just re-break it, straighten it out.
So what is it, like when you sneeze, like your nose like hurts right here, or like it burns?
Oh, that's just your sinuses. That's just your sinuses. And the reason why you sneeze is the same reason why you cough. You have these mucous membranes that their whole goal, along with the turbinates, is to bring and produce mucus so that when you breathe in a foreign invader, they get stuck in the mucus. And then what happens is your body goes, oh my God, look at all of this mucus and all these foreign invaders. We gotta get rid of this. Tickle, tickle, tickle. And you'll sneeze, and usually you will clear out some of your sinuses. Or it'll tickle, 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 and you'll just have the need to go blow your nose. And then when you look at it and you see all of the snot, that's the mucus that is now holding the foreign invaders.
And it doesn't change color until you're infected. It's not like you have the mucus and like a foreign invader and it's immediately changing color.
Yeah, so right now we all have foreign invaders going into our noses. Even with the mask on, you still have some foreign invaders. Pollen, stuff like that. Now, depending on how your immunity group reacts to the foreign invader. Me, I'm allergic to pine pollen. My immunity group believes pine is going to kill me. So what happens is I'm developing and producing a lot more mucus But when my white blood cells, I have an immune response. When my white blood cells get there, they're like, we don't really see anybody to wage war against, so we're gonna go. That's why you get the clear snot. If it is a foreign invader that is in fact something that my white blood cells go, oh, holy crap mode, that's when you're gonna get the turn in the color. Because now what you've got is not only the death of the foreign invader, because pollen, there's nothing to kill. If you have an infection like a bacterial or viral, now you've got dead bodies first 5 minutes of Saving Private Ryan. And that's what's changing the color of the mucus. It's pretty cool though, right? Picture. There's all our pictures. There's the turbinates. There's our hyoid. Hyoid is the support. Right down here, it's just under the larynx. It's going to help to support the larynx. And as we said last week, not like this, like this. You don't want to break your hyoid. All right. Comments, questions, concerns?
I have one more question. Sorry,
Yes.
to find this one. When it is turning green, would you like consider it purulent, or is it like, is that just if you have like plastic somewhere else? Is that considered plastic?
So purulent is kind of combination of not only color but consistency. So you can have the mucous membranes in your nose can produce more of a serous, which is just your normal everyday snot running down, or purulent where it gets very thick, very colored. So just kind of serous or purulent. The term purulent really refers to not only the color, but also the consistency. How thick is it? All right, so now we're going to move in. We finished the skull. Now we're going to move into the spinal cord. We're still in the axial skeleton. We have our cervical, thoracic, lumbar, sacral, and coccygeal, moving from head to tail. With this, I don't think we're going to need to spend a whole lot of time because you've already covered all of this. Cervical vertebra. What is the first cervical vertebra called?
Atlas.
The atlas. The second cervical vertebra.
Axis.
The third cervical vertebra.
Cervical.
Ah, see, I'm a cheeky monkey. I tried to trick you.
C3.
C3. I'm not even going to ask because it's up here. Hooked on Phonics work for you. There are 7 in the dog and cat. Thoracic vertebra articulate with what? The ribs. So if I have 13 thoracic vertebra, how many pairs of ribs do I have?
13.
How many individual ribs do I have?
26.
Very good, 26. Lumbar is the lower back. Dogs and cats have 7. Sacral, what do I know about the 3 sacral vertebrae?
They're fused.
They're fused together. And this forms an articulation. Whenever I say the word articulation, I mean what? A joint between 2 or more bones. So this articulation at the sacrum is where the sacrum and the ilium of the pelvis is called the sacroiliac joint. And then your coccygeal, which is your tail. And these can range from 0 to 13 or even more. So those are our spinal vertebra. I have a vertebra here. And so we're going to talk about all of these processes. Remember, process is just anything coming off of the main body. And then these vertebra hinge into each other, and each has a padding or a disc in between, which is just a fluid-filled pad like gel soles for your shoe, and acts as a shock absorber.
The diaphragm connects to the lumbar vertebrae, correct?
It does. Yes, right at the T13L1 junction. But it's a dome-shaped muscle. And so even though it attaches here at your 13th rib pair and basically forms just a complete divide in between your thoracic and your abdominal, when you breathe, it moves. So when you breathe out, it's like this. Breathe in, breathe out, breathe in. And we'll get into that a little bit more when we get into our respiratory system this term. Doesn't matter the breed, it doesn't matter the length of body. Every dog, every cat is going to have the same. Whether you're a Dachshund, a Chihuahua, a Great Dane, 7, 13, 7, 3, various is the formula that we use. Now here I do have a long-bodied, short-legged dog. This is a dog that we bred achondroplastic dwarfism, which is where those growth plates close prematurely. And that's why you get in the extremities the very short but very wide bones, because their body is still telling grow, 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 but I can't grow in length. What disease are these guys at risk for? IVDD, yeah, intervertebral disc disease. All right, so we have some characteristics to our vertebra. We have the body, which is the main part, this big kind of the chunky weight-bearing part of our vertebra right here is the body. We have the arch, which is exactly what it sounds like, forming the opening for the spinal cord to move through. And then we have some processes, and processes just anything coming off of the body. Transverse processes, cross. Absolutely. Dorsal process. So in me, it would be in this position. So there's my dorsal process, pointing dorsal, transverse, pointing laterally, and the can't see, my articular surfaces where the other vertebra is going to come in contact with it. So the body, the arch, transverse, dorsal, articular.
So whenever we refer to it, we would always refer to the dorsal as spinous.
Do what, I'm sorry?
We refer to the dorsal process or the spinous?
Oh yeah, dorsal process, spinous process are interchangeable.
Okay, I didn't know.
It's one of those, depends on who taught you.
Okay.
But yeah, dorsal process, spinous process, same thing.
All right, thank you.
And these ones that I have, you're more than welcome to come up and take a look at them. I bought them back there. These are real, these are bovine bones. These came from a live, well, no longer alive, but once a live cow. So it's still got some of the, although this disc has kind of dried and hardened. You can see that, you know, the very different consistency of the disc here versus no disc here. Still considered the body.
So when they're in the actual body, the discs, are they actually hard or are they malleable?
Oh no, they're very, so literally think a liquid gel insole for your shoe. So the gel insole on your shoe helps to cushion and shock absorb. But if you fell out of a, you know, 2-story window and you came down on those gel inserts, what's going to happen to them? They're going to rupture. That's this exact same thing that's happening when you rupture a disc in your back. It's squirted out and lost all of its fluid and is now part of it has squirted out and is now trapped So every time you move, it's pinching this disc tissue. If you've ever, I personally, knock on wood, that's one thing I've never done is ruptured a disc in my back, but I've heard that it's paralyzingly painful. Well, what they have to do is go in and remove the disc, and then they put in an artificial one.
Is it like the same for what a slip is?
Yeah, so a slip disc is where you haven't completely ruptured it, but something has happened and the disc has slipped, and every time you move, it's just paralyzingly painful. Because it's literally, you have this and then you have another one that butts right up, and every time you move, it's pinching it because it's stuck out here. There's just a picture for you guys, my little visual learners, of all the components.
Go back real quick, please.
I'm sorry, I didn't get that.
Can you go back?
Oh, yeah, I can go back.
What kind of cartilage was it made of again?
What kind of cartilage is what?
Oh, because it says the type of cartilage that makes it.
Miss Huff.
Oh, hang on 1 second, Zoomer.
Yes, ma'am.
In the body, like the
In the
type
body?
of cartilage.
Oh, the primary type of cartilage that you have on all of the articulating surfaces is the hyaline cartilage. Zoomer, what is your question?
Yes, okay, so when we were labeling the bones, I got very cattywampus in like the trying to fandangle between caudal and ventral and dorsal. And I know the placements, but once they start getting into different configurations, I get lost.
Okay, well, if you're having trouble
On
with
their
your
placement.
directional, if it's just your directional terms, that's something we'll have to go over privately, because I'm not gonna go back 8 weeks material. and go
No,
over-
I'm meaning, I know where the placement of the bones are. It's just once they turn, I get lost. That's what I was meaning.
Okay, again, that's just gonna be practice. There's not a whole lot I can go over as far as, we'll need to go over that privately.
Oh,
Again,
okay. Yes, ma'am. I'm sorry. Okay.
okay, but those directional terms, I kind of said all last 8 weeks. If you don't know these, you're gonna be in a little bit of trouble, because we covered those literally week
But I
one.
thought I had it down.
That's okay, then if you don't, then we will meet together and we will have a tutoring session.
Yes, ma'am. Thank you for your help.
So here is the picture of our vertebra, just outlining for you, so you guys, you don't have a vertebra at home to look at, bam, picture. There's our IBDD, intervertebral disc disease, you already told me. Long body, short-legged dogs. And the most common place that you're gonna get this IBDD is right at that T13L1. Because if you think about it, think of your thoracic vertebra. They're not only articulating with each other, but they're articulating with my ribs, which come around and articulate with my sternum. Of all of the vertebrae in your entire body, your thoracic vertebrae are the most immovable. You can't move your thoracic vertebra independently. Like you could do like a little, like, you know, like this. But when I bend over, what vertebrae are allowing the mobility? The lumbar. So you go from flexibility, zero flexibility, flexibility. And so it's right here that we have that weakest part. When you have those long-bodied, short-legged dogs, what happens is like when they go and jump off, even something as high as this, their front legs hit, back legs keep going. And you end up with a separation of that articular surface. And generally what we're gonna have to do is surgical intervention to fuse the bones together. so that it doesn't happen. And if you can have animals that do become paralyzed, because if you have enough mobility, it'll traumatize the spinal cord. Yeah. No bueno. Here we have a picture. Get my laser pointer here. So here we have, you can see the ribs. There's a rib. This is our T13. That's where the last rib has articulated. So T13, L1. Now, what I'm looking for, this is sometimes a little difficult to imagine. So when I'm looking at the lumbar vertebra, because that's going to be, even in your quadrupeds, the part of the spine that's most commonly going to be traumatized, especially in your bipeds. Us, lumbar vertebra is where we have all of our damage. What we're looking for radiographically is I have a lumbar vertebra and a lumbar vertebra. Now, obviously, if you're looking at it like this on the radiograph, if I have shifted this way or this way, it's going to be very evident on the radiograph, right? What happens if I've shifted this way? It's really not going to show up if let's look at my shadow. See if I can do this. So looking at my shadow, this is the radiograph. So we can see shift this way, right? We can shift this way. How about shift this way?
No.
So this way, yes. This way, yes. How about now? Not really. And so what we do is we have some spaces in between the vertebra that we look at. We specifically refer to them as horse heads. If we look at the space, so here we have a vertebra. This animal is in lateral recumbency, so this is a side view. Do you see the space here, how it looks like a head of a horse? You have to use your imagination a little bit. There's the muzzle of the horse, the ear, the neck. Here's the muzzle, ear, neck. Do you see how this guy looks like he got stung by a big bee? That's what I'm looking at. That indicates that these discs are out of normal position. So what we're going to look for in the lumbar is the horse heads. Then we can take a myelogram, which is just a different type of imaging. It's called an alternative modality. And you can see here, we have a disc that is putting compression on the spinal cord, which is super no bueno.
That's not the same thing.
Not the same thing as a what?
It's not the same thing, it's not.
Yeah, so intervertebral disc disease means that something has happened to the spine. Depending on the severity of the damage, this could be part of IVDD where we have spinal cord involvement. You don't have to have spinal cord involvement to have it be classified as IVDD. Intervertebral disc disease means something has happened to the space between the disc. How severe it is determines the type of treatment we're going to do. All right, so now we're just going to buzz through these because you already know. Cervical vertebra, 7 in the dog and cat. C1 is the atlas, C2 is the axis. I'm not telling you any shocking new information here. Your thoracic vertebra, tell me how many in the dog and cat? 13. 13. Yeah, 13. And they communicate with the ribs. They communicate with the ribs. Lumbar vertebra, dog and cat, 7. And this is gonna be the most common site of injury. They're also the most massive, heavy-looking bones of the entire spine. Especially in weight-bearing animals like our horses. Because although the majority of the weight of the person is up over the thoracic vertebra, if you have 2 people riding on a horse, where is that additional weight? On the lumbar. On the lumbar. So that's why you should not double, for any of you that have horses, you gotta be really careful about the weight distribution.
That's the reason why jockeys have to be small.
Well, yeah, because also you don't want to weigh down the horse. The more weight they're carrying, the less fast they're gonna go. Like I can run like crazy. I'm not gonna demonstrate because last time I did, I knocked myself unconscious. But you can run super fast, but imagine now you're carrying 100 pounds. Your sacral vertebra are 3 bones fused together that form a joint with the ilium. So it is the sacroiliac joint. Your ilium, remember, is your sassy bone. Coccygeal is your tail. Humans, we do have 1 to 3 coccyx. It's your tailbone. Traditionally, we don't have more than 3. Some people do. I don't want to know if you do. But that would be known as a vestigial tail. You can break your tailbone. Yeah? How'd you break it? Oh, geez. I slipped and fell on ice.
I fell off and I hit the railing and then I landed on my head. But I had a helmet on, thank God.
Oh, gosh.
Helmet. But yeah, I was young too. I was like 11.
Thoracic vertebra are going to articulate with the ribs. Somebody tell me the medical term for rib. Yeah, costo. Costo. Oh, hooked on phonics. It's right up there. Sternal ribs attached directly to the sternum. Now, what are the ribs called if you have ribs that attach directly to the sternum?
True.
True. And then if you have some that are indirectly attached? False. And then some that only have a thoracic vertebral articulation. There you go.
So when people like get ribs removed and stuff to like get a smaller waist, are they removing the floating ribs or like false ribs?
I didn't get any of the first part of that.
Like when people remove their ribs to like get a smaller waist.
Oh, I have no idea. I'm assuming it's the floating ribs, but I don't really honestly have any idea. IQ points, definitely.
Yeah.
All right, so we're gonna pick it up here on tomorrow. Tomorrow we are gonna be turning and burning because everything as far as the bone identification, you went over right before the break. So when we get into appendicular, we're gonna be talking about scapula, humerus, radius, ulna, carpus, metacarpals, phalanges, ilium, ischium, pubis, humerus, patella, tibia, fibula, tarsus, metatarsus, phalanges.
So in terms of timeline, do you want the labeling bones by Wednesday? And then so on Moodle, midterm says it opens on the 15th. Is that true?
No.
Okay. When?
No, I have not opened up the Moodle midterm yet, and we won't do that until we finished our skeletal system.
Okay, so we just don't. Do we just think that'll be like this week?
I have a question. So the labeling of the bones and the, I don't know if I missed it, the test yourself question skeletals, all of that is due on Tuesday.
So what I'm gonna do, originally I had it do, what I'm gonna do is just like last term, the test yourself questions will be due at the same time we do the test.
Okay.
I will go ahead and make your labeling do the same time. We have not yet announced when the test will be. It will be later this week.
Okay.
I mean,
Okay, yes, ma'am.
maybe Thursday.
Miss
Huh?
Huff, you're awesome. Miss Huff, you rock.
Thank you. So yeah, it's not like it's gonna be tomorrow. We still have all the appendicular skeleton to do. So, okay, everybody take 10 and I will see you back here at 11:30 for nutrition.
Then
You